Hi, I am Dr. Abhilasha Malik, physiotherapist with specialization in cardiovascular and respiratory sciences. Today, we will talk about the role of functional medicine in diabetes reversal. And as a guest speaker, we have today Dr. Trishula Chopra. She is the founder of Health Medic, a global award winner, an international speaker with over a decade of experience in treating lifestyle disorders. She has treated over 10,000 people for various disorders like diabetes, cardiovascular diseases, sleep disorders, gut issues, obesity, and so much more.
Thank you, Dr. Abhilasha, for having me over. I'm pretty excited, and I want the world to know, I want the layman population to know that functional medicine is not something very fancy. This is something that we actually are practicing in our daily lives, but now we have a structure to it. So coming to the topic of functional medicine, which is quite a booming word nowadays. So a lot of articles, a lot of influencers have been mentioning about functional medicine. So this is something that completely changes our outlook towards a disease. And the reason why I chose to be on this side of the world and not on the prescription side is because I thought there are so many people who are already prescribing things. They're there to tell patients what to do. But how about looking inwards and seeing that is there a possibility of getting the disease completely out of the system instead of managing it? So that's where my interest in functional medicine came up. And I had to do a lot of other courses along with the main specialization because everything is research is going up like anything. Okay. So, if we even miss out for an hour, we have a new research altogether which comes up. So I'm very keen. I'm an avid reader. I want to know everything, what is happening everywhere, be it in my medicine life or be it in my personal life. I want to be everywhere. And that's what kind of encouraged me to take this up as a profession. And functional medicine, when I am seeing a patient, for me, that patient is a complete patient. So, for example, when you see a cardiologist for your heart, you see a nephrologist for your kidneys, they are most likely looking at the organ and what to do around it and what medications to change and what food habits we should work on. But when you come to a functional medicine practitioner, we kind of zoom out. It's important to look at a disease from a complete perspective instead of just putting them in compartments. And that's what helps us understand the patient more. So when we are getting into their history, there are a lot of things that we cover. We talk about their lifestyle factors, we consider environmental factors, their emotional status. All these things are equally important in managing a disease. So whoever comes to me, they know that they're not only coming to me for nutrition. They're not only coming to me ki ye drug ko बढ़ा दो, वो drug ko kam kar do. They know and they are ready that she is going to ask us what they might not even think about, like as simple as कि आपकी बेटी यूएस में रहती है and क्या टाइम जोन है उसका और आप कितने बजे उठ के बात करते हो उनसे. This thing becomes equally important, right? Because this is messing up my patient's sleep cycle. So instead of me giving her the lecture on, oh, it's important to get 8 hours sleep, or get in the bed at 9 o'clock, it doesn't really make sense because she has a daughter. She wants to speak to her daughter, and irrespective of what the doctor says, she is going to go back, call the daughter up at 1 o'clock and somehow deal with it, right? So instead of having that major disconnect with the patient, how about learning this important aspect of life and maybe changing the advice completely so that person is able to practically apply it in the life rather than just book knowledge or something that we hear from doctors. So this pretty much is the crust of functional medicine, and there's a lot more to it, but we keep it simple for people to understand that it is pretty much everything that you do in your life and what factors contribute in progressing your disease is what we look at.
How important is stress management and emotional regulation when it comes to being a functional medicine practitioner?
I think that is the first thing that I address before even talking to them about what their laboratory reports are or what medications are they on. So it's very important because there's no point constantly talking to the patient and giving our gyan, which we think might help the patient, but patient is not in
Not
that
going to follow.
entire zone to understand. Like, if you and me are having this conversation and say if you have had a bad day, and if I'm still continuing my bhashan, no matter what kind of bhashan I'm giving, and so important, so interesting, you will not be able to process it because you're not in that mind frame. So when a person, for example, is coming to me with high blood sugars, I'm not the first point of contact. Sadly, I am the last resource in their life. They have tried so much in the past, nothing's worked, and that's when they come to me. And if I also start the same traditional way, is okay, aapka medicine batao, kitna medicine, kitne baje lete ho, and they will have that look in their face that मुझे आपसे ज्यादा पता है इसके बारे में. They know about medicines more than actually I might know, because some of them are actually living with diabetes more than my entire age.
Yes.
So for me to just act smart because I have that degree with me does not really make sense. So I kind of zoom out, see what a person feels. Emotions are very, very important for me. It's important to address what that person is going through. In fact, just right before we got on this, I had a patient, and he was sharing something about his trauma that he has been through in the past few years. And he said that I thought this might be important, but if it's not, just ignore it. So he felt that, that this major information might not be important for me, but that completely changed my outlook towards the case, because I could pretty much link to everything. So yes, stress management it's not simply just telling them ki meditation karo, yoga karo. I wish it was so simple, so everybody would have done it. There would have been no stress in the world. For you, it might be going for a jog. For me, it might be partying till late or whatever. We all have different ways we channelize. So it's important to know the person and yes, address the stress management to cure or at least stop the progression of the disease from the root.
And do you collaborate with the other healthcare professionals, like a dietitian, an exercise specialist? How important is it to collaborate with them?
Oh, absolutely. I think, Dr. Abhilasha, in today's world, if we don't have a team of like-minded people, it's very difficult to survive on our own. So no matter what we think that we are really smart and I'm good at what I do, I'm very confident at what I'm doing, I know what the outcome is going to be, but still it's important to have other people on board. So I do collaborate with dietitians. I collaborate with physical therapists. So to be honest, I collaborate with the physiotherapists more than I do with the dietitians, because I have a certain way of practicing, and sometimes that might not match with the criteria of the other healthcare professionals. So I kind of keep the nutrition to myself, but I definitely need the exercise physiotherapists on board. So say if I have a patient with Alzheimer's or Parkinson's, we do need to refer them to a physiotherapist who is aware about it. So like a neurophysiotherapy. If somebody is going through a cardiac issue and needs a cardiac rehab at home, I cannot refer that person to an orthopedic physiotherapy. There's somebody who has already done the specialization, taken that efforts in their life. So it's important to collaborate with people who might work perfectly on that cases, nephrologists, cardiologists. It's all good to have everybody on board so that we make it simple for the patient. That patient doesn't have to run 10 places and tell us what 10 doctors did. If we are able to establish that connect and have that internal word that, okay, Dr. Abhilasha, this is what the patient might need. You might tell me, Tushala, I think this might not work for the patient. It's easier to help the patient get better. And that's why this collaboration is very, very important. So I'm in for it. Yeah.
And how do you monitor and how do you go about tracking the progress? What are some of the key metrics which you keep in mind when you're tracking their progress?
Thanks to the technology and the ways to keep data, which ideally was not very easy even when I started practicing. So, even like about 10, 13 years back, the data was still picking up. So still notebooks was something that I used to carry, and I still do. I kind of like that. But data collection is very important, and putting it in the case studies or putting it in the research journals, we need to know what's going on. So I do have a set of blood reports that I ask my patients to take before they start the program with me, treatment with me. And then I monitor that at least over the next 3 months. I don't like asking for blood test when it's not going to change my management. And this is what I had learned in my previous organization, that don't ask for a blood test if you don't know what you're going to do with it. So I swear by it. And only if I know that this kind of blood test means I have to change my entire game, only then I go ahead and prescribe it. Otherwise, I pretty much consider the reports which are done even in the last 3 to 6 months. And that's one thing. Blood reports are very crucial. Apart from that, I do require their waist circumference, their weight, their BMI. So I don't ask people to check their weight every single day before they poop, after they poop. This kind of plays on everybody's mind, and
Mental
it
health.
might not be very sustainable. And I don't want to make them disheartened, because I know that fat metabolism, fat changes can take up to 6 to 8 weeks. So it's very unfair for us to ask our patients to get on the scale every single day to see what water changes are going on, because you and me might understand, but patients will not, right? So rather than using that as a demotivator for them, I kind of just ask them to check their weight when they start the program. And to be honest, my patients forget that they have come to me for weight management, because they see so many other NSVs, non-scale victories, that the main goal for them actually becomes like a byproduct. And by the time 3 months are done, they've lost good weight. And then they tell me, oh, I forgot to tell you I've lost weight. So that was the first thing they came to me, but eventually we forget to discuss about it in our conversation. So this gives me a very good indicator. And NSVs, like I said, non-scale victories are important for me. So how a person is feeling about themselves, how they're looking in the mirror. So there are a lot of patients who come to me with bloating, and they can actually make the difference when their body is in the water retention mode or no. So kind of, just looking at your body, what you're doing, making a note of it helps me a lot. And of course, when I see the person, I know that there are changes. The person is glowing. So for me, this is a metric which I take it as a very, very important thing, that if a patient is not glowing, if the patient is feeling dull, not okay, that means there's definitely something between the last call and this call that did not work for them. So that is something that I consider. And for my patients with diabetes, I do consider getting them on a CGM device, a continuous glucose monitoring device, which gives me a lot of insights regarding how the blood sugar levels are working on. And I'm sure we are going to be covering this in our future discussions as well. But just to give a gist, continuous glucose monitoring is going to monitor your blood sugar levels for 24 hours. So even when you are sleeping, when you're taking bath, you wear the device and you can play squash or you go swimming till a certain depth. This continuously gives us the readings, which gives us a very good graph to understand that how a person's body is reacting. So for me, it's not as easy as telling them, oh, mango mat khao, aapko diabetes hai. I wish it was so simple. I have patients, and especially I have Gujarati patients who have mangoes, and they ask me that, no, mango to main khaunga hi, wo to mat nikalna, blah, blah, blah. But surprisingly, it doesn't affect their blood sugars. So there are so many patients with a good metabolic profile where mangoes are not really doing anything to them. So who am I to tell them to reduce mangoes when the body is accepting it? So just CGM helps me make them understand that it's not about a single food that you are eating. It's about the entire lifestyle. It's about your weight. It's about your metabolism. And that's how different foods will react to it. So that's where CGM comes into picture. And I've been seeing a lot of patients now, even without diabetes, getting on the CGM to understand how their body responds. But the sad truth is, Dr. Abhilasha, they don't know how to decode it. And that's creating more of a panic versus a device which is helping them. In fact, I just had a patient yesterday, an absolutely normal patient, and he got on the CGM. And suddenly he started seeing his blood sugar levels going down. So that was a pretty much a state where he was working out. So that's obvious that his blood sugar was getting into a good normal zone. But he actually panicked. So he panicked and he went to eat more sugar, and he consumed a lot of sugar thinking his blood sugars are going down. And as a result, he got a major high. So he did not need sugar at that point. He was not even hungry. He was not having any symptoms. But just because the device beeped that the graph is on the downward trend, he actually went and consumed sugar. So this is one such patient who I have in my practice, and I am able to educate them. What about the patients in the world
So
who are
many of
doing
them.
this on their own, right? So it's so risky. I've seen so many people actually developing diabetes after getting the CGM because they are more worried about the low sugar versus the high sugar, and they constantly keep eating so that their graph is in a certain range, but failing to understand that this is a trend that we use. This is not your blood glucose. There might be discrepancies, there might be changes on their hydration. So it's important to educate the population. It's important to educate layman, medicos, our fellow colleagues to know that this is what it is and this is how they can, transfer the information. So yeah, so these are pretty much things that I can think on the top of my mind that I use in my practice.
Yeah, we need to be pro about it because patients are going to come and ask us, and if we only don't know how the trend is going on and what is exactly the normal range and what is not, how are we going to educate them? And they're going to get
That's
mentally
true.
stressed even more because, yeah, half knowledge is dangerous.
That's true, and that's what is happening. So in fact, the current generation, our lifespan beyond 40 years is questionable. So we had our ancestors living for 90, 95 years, but we are even questioning whether we'll be around for the next 10 years or no. The amount of cardiac arrest cases going up in the last few months has been tremendous, and it's sad to see me losing my classmates to this. So it is something that we have to work upon, and half knowledge is definitely dangerous, but we have the data, we have the resources. I will urge people to take help from the professionals, understand your case thoroughly, make sure that you are checking what is the background of the professional that you are actually going to, make sure they're registered, they know what they're doing. It's all for you. At the end, it's all about the patient. We are still going to be in the practice and see different patients every hour, but at the end, they are living in the body. So maybe giving the key in their hands so that they're able to do it better is what I focus on. That's my motto in life, actually.
Nowadays, people are becoming more and more aware, but they still don't know what are the key lifestyle modifications which they keep in mind, what all they should focus on exactly. They want to do everything at once.
Fixes, right? They want quick fixes. We
Add
have
diets and
instant
quick weight
rewards
loss.
available. We want to eat something, craving for a hot chocolate. Oh, I will just go on Swiggy and
Order
I'll get
one.
it in, like, before this call finishes, I'll get my hot chocolate in my hand. So we are used to this. So thinking through, having patience, understanding how your body reacts is something that we have to learn a bit more, and we have to do it a bit proactively. And I think medicos, healthcare professionals have to take the front seat here to understand that, because there's so much information out there. It's a cluttered space. Sometimes even I start doubting my degrees that, oh, okay, did I learn it right? Did I learn it wrong? Because so much information to consume, right? So kind of sit and segregate what information actually works, it's difficult. So imagine what a layman person is actually going through when they get diagnosed with a specific disease.
So what are the key modifications which you suggest, especially with respect to diabetes here?
Yeah, so it's not a one size fits all modification. And we all have to keep working on the areas that might require a little bit more attention. So definitely working on nutrition, which works at the crux of everything. Okay, and so many diets, low calorie acha hai, makhana acha hai, this acha hai, wo acha hai. I keep getting a lot of these questions. So the first 15 minutes of my calls are actually making them unlearn what they have already learned, so that whatever I'm teaching them helps them. So yes, make sure that you're monitoring your carbohydrate intake, make sure you're monitoring your protein intake, healthy fats, how much, what your body will guide you. Take your body as your guidance rather than any diet plans. If you can take the suggestions from the professionals, but at the end, your body is going to respond in a very different way. So, for example, the world will say that the sprouts are excellent, but sprouts makes me very bloated. I feel terrible after eating sprouts. So, does that mean that I should still continue? Maybe not. I have to honor my body because this is what my body is trying to tell me. So, you can follow whatever diet that works for you. Make sure you're monitoring your macronutrients before you shift to your micronutrients. So when I talk about macros, it's your carbs, your proteins, your fats, and macros is all your multivitamins, everything. So I see people going very heavy on supplementations when it comes to vitamins, but their macros are not at place. So it's very sad for me to see that they're fixing with supplements, but they're not fixing what they actually can, which is free of cost. Which is free of cost to just change the portion size in the meal that you're already having. And so that's important. Fix your macros first. Get in touch with healthcare professionals to see what macronutrient goal might work for you. You might have a different goal. Dr. Abhilasha might have a different goal. I have a different goal. So we have to take your lifestyle into consideration and work on the food changes. So yes, work on your carbs and proteins, exercise. You are a better doctor here, person here to let us know that how important it is to exercise. But it's not as simple as 30 minutes ka walk kar lo. It's good. You're taking that step for your life. At least you're not sitting on your couch. You are going ahead and taking the step. So congratulations for taking the first step. But it's also now about taking the second step, right? So what else you can add? Please get in touch with the physiotherapist first instead of going ahead with gym trainers. You might be injury prone. It's important to know what areas you need to first work on strengthening before you hit the gym and try to do it all by yourself. It's important to protect you from injuries. It's sad that people feel that, physiotherapist ka kya zarurat hai? Mujhe to koi pain nahi hai. Mujhe to koi condition nahi hai. So why should I see a physiotherapist? Well, that's not the truth. You need to see a physiotherapist so that you can avoid injuries with your daily life, daily routine. It's not only till you actually fall sick. It's also about prevention. So get in touch with your physiotherapist, understand what strength training protocol will work for you. It does immensely help in cases of diabetes reversal. I have seen things completely change when a person introduces a strength training protocol in their routine. So we require healthcare professionals, physiotherapists to get the strength training and make them understand that it's not age related. Ki 70 years mein mujhe kaun si muscles banani hai. This is what I get to hear from patients, but it's not the truth. आप कोई भी एज में अगर आप जिंदा हो तो you have to make your muscles. आपके muscles strong होने चाहिए ताकि आप अपनी body को carry कर सको. It's not about aesthetics anymore. So yes, do that. Of course, working on your sleep cycle is very, very important. There are people who might not be able to stick to the night sleep routine. There may be night workers. I cannot ask a pilot to go and sleep at 10 o'clock, right? Or maybe I cannot ask, we all have done night shifts, right? We've all been in the hospitals and done night shifts. So agar hum so jate to probably patients ka jaan kaun rakhta. So there are many cases where night shift workers are considered. Yes, that increases the risk of getting metabolic disorders, diabetes by a certain amount, but that doesn't mean you should not take care of yourself. So there are ways which the healthcare professionals can help you, guide you to get the maximum of them. And stress is definitely something that everybody needs to address. I'm not saying that stress management is sab kuch chhod chhad ke sadhu ban jao. Absolutely not. That's practically not possible. Even traffic can stress you out. As basic as aaj ghar mein maid nahi aayi is a very stressful topic for people, right? So don't ignore your stress. Address it. Your body is trying to talk to you. See what your body is trying to tell you. Take a break, hold on, take a deep breath, understand, and then proceed and react and take help. There are so many professionals out there who are willing to help with the stress, be it counselors, be it psychologists. There are other methods that are coming up like hypnotherapy, cognitive behavioral therapy. There are so many things available. If you just reach out, you have help available. So you don't have to do this on your own. There are people willing to help you right there.
And there are also a lot of myths about what to eat, what not to eat. Like you just talked about mangoes, right? People will be like, don't eat mangoes. But then the people will be like, we have to eat mangoes. How can you not ask to eat them?
Yeah.
Then certain will be like, this contains a lot of sugar. Rice has a lot of sugar.
Yeah, I know, it's easier to focus on what is not good for you versus what is good for you.
Good for you.
So even when we are talking about ourselves, हम सबसे पहले वो देखेंगे जो सबसे बुरी चीज है. Oh my God, my hair is so frizzy today. No matter how beautiful I look in that outfit, but the first attention will go towards what is not good for me. So we are so used to listening to negativity. We're so used to listening to what is not good for you that we actually completely forget that what is actually good for you. उस पे focus क्यों नहीं करते? If you like mangoes, great, perfect. How much is the question? When is the question? What time of the day that mango works for you is the question. There is somebody who the mangoes completely work for breakfast. There's no blood sugar spike. The same mangoes, if you are eating at night, does show us glucose spike. So it's easy for me to just tell them ki mat khao yaar mangoes. But it's not as simple, na? I know the data. I know what it is. So understanding how your body is responding is important, and आपको automatically list मिल जाएगी जो शायद least effective होंगे. I don't ever use in my practice avoid, don't eat. ना ये ला मेरे तरफ से list जाती है. Neither you will ever hear these words from my mouth because I honestly don't know. I don't know what is not good for you. A South Indian reacts completely fine to rice. A Punjabi completely reacts fine to wheat. Then who am I to tell them and give them a blanket list ki kya nahi khana hai? Rather, work with them, make them understand that the days when you were stressed, rice gave you a high blood sugar. The days when you were pretty happy, you did your workouts, you went for a walk, the rice has not really done anything to you. So it's up to you. What is more important? You can keep the rice, maybe add in an activity, maybe try and doing some meditation, or you can simply avoid the rice because you can't do anything else. So we should make the list. There's nobody else who's here to give me the list of what works for me, what doesn't work to me, because nobody knows my body more than I know about it. So yes, we know as a professional, as a healthcare professional, we know it because we have studied about it. But we know that it's not above human bodies. Sometimes we see miracles in the cases where we completely give up hopes. So that means that body has something of our own. So yes, learn about your own body. See what foods work for you, what doesn't work for you. What foods are high in carbs are different than what foods you should avoid eating. The list might absolutely look the same, but these are two different things. So don't confuse yourself with carbohydrates avoid करना है या ये चीज हमें खानी है. ये food है, इसमें carbs ज़्यादा है. आपकी sugars बढ़ा सकते हैं, बढ़ा रहे हैं, नहीं बढ़ा रहे हैं, वो आपको try करके देखना पड़ेगा. So people who are not on CGM, they don't have a device to monitor, they can still know. Check your blood sugar levels before eating the meal. Check the blood sugar levels 2 hours after eating the meal, and you will exactly know how that food worked for you. If your blood sugars are stable, that means there's no need to cut them out. Love your favorite foods. Try and find a balance. See how you can make them a part of your life and go ahead and enjoy. You have a very short life to live.
Well said. That is so true. People are just stressed more about what to eat, what not to eat. Okay, this can be had, this cannot be had. That adds up more to their stress levels rather than the food itself.
100%. And they wait for me to give them the lists ki kya nahi chalta hai. And by the end of the consultation, they to sab kha sakte hai. Despite me talking to them for 30 minutes, they will be to sab kha sakte hai. Banana, mango, ऐसे सब खा के देखो. Check your blood sugars. और आप मुझे बताओ आपको क्या करना है. They pretty much come up with their own list at the end of 1 week. So it's about the support. It's about the patience that healthcare professionals have to show. And that's it. We have to give that time to patients. They're telling their symptoms when they're talking to us, even without them mentioning about their stress. If you listen to them for 2 minutes, you will exactly know what's going on with them. So that level of connect is what I have learned through functional medicine.
Can you share an example of someone who's had diabetes and how you have reversed it?
Oh, yes, I have so many of them, but I can tell you something that is on the top of my mind because this happened just about 2 days back. So I had a gentleman, 75 years old, and normally we consider that age ki sab khao na jaane do kitni zindagi bachi hai type age, right? I don't, but most of the people do. So this gentleman came to me and he stays in Texas, US, and they got my reference from somebody, and the wife messaged me because the patient itself cannot hear very clearly. So the wife was following up with me and she's like, the doctors have asked him to now start the insulin for the last leg of his life. And his kidneys are affected, his heart is affected. So there's a whole lot of medications. But I got to know that maybe we can do something because we have not started insulin for him yet. So this day, his blood sugar was close to 464 mg per dl. So just for the population to know, the normal blood sugar levels post-meal is less than 140 mg per dl for people who don't have diabetes. So he was at good 400 plus. And so they asked me, Abhi kya kare? Abhi kya kare? Abhi kya kare? I told them that this has been for a while. Let's take a step back and see where the triggers are. And uncle was very happy to do it. He's like, it's fine. I don't consider this as the last leg of my life. I consider this that if I work on myself right now, I might be living and celebrating my 100th birthday. So I am looking forward to that. This is not the last leg of my life. And we worked on the basis, we worked on the changes. And he did not have to go on insulin. Forget insulin, even the medication which he was taking, the doctor had to stop him because he was going through a low blood sugar episode because of the lifestyle changes that we actually made. So doctors were forced to take the medication off the prescription, and he lost good amount of weight. And it's been about 3 months. His blood sugar levels, which were at 464, has not crossed 140 despite eating a good carb meal. What helped in the last 3 months was compassion, giving them what he could do rather than literally giving him unrealistic goals to achieve. That age requires a different goal setting. I cannot give him the same goals like I'm giving to you. I cannot tell him ki gym jaake tabhi 10 kilo ka dumbbell utao, right? I cannot do that. As much as it's in the protocol and I have to educate him to do strength training, it's very difficult. Honestly, practically, wo possible nahi hai. So we have to see what is possible, what he's willing to do. If nutrition is 100% in his game, let's just work on that now. Utna to karte hai. That's okay. Even if we don't get a perfect report card, we're still going to get a good health out of him. So touch wood, it's been 3 months. There's no insulin, there's no diabetes medication, pretty much normal blood sugars, and he's going to celebrate good 78th birthday now in the next month.
Wonderful.
So yeah, at whatever age you work on, it is possible. You just need somebody to guide you in a way that works for your lifestyle. Don't try and copy somebody else's lifestyle. If intermittent fasting worked for me, it's not necessary that it will work for you. So instead of getting disheartened that, oh, I cannot fast, oh, I cannot do this, let's focus on what you can and maybe navigate and figure out a way. Diabetes reversal is not a myth. It is possible. We do for a few tests to see how your pancreas are working. The test is fasting C-peptide. So anybody who wants to know what is their current pancreas working stage, please get the blood reports done. And there's a range. So get in touch with your doctors. You can get in touch with me to understand what the report actually means and whether there are chances of diabetes reversal or no. So 99% of the people who come to me actually are able to work towards reversal at a certain limit. Every reversal for different people means different. So yeah.
That was a wonderful example of how things can work when you consider the person holistically, when you take a proper approach, when you consider all the factors possible.
Yep.
People don't know. People still think that once you're on anti-diabetic medications, you're done. It's going to be there, continued, lifelong. You can't get off those medicines. People don't know diabetes reversal is possible.
Yeah, because we have been brainwashed them so much that to reverse diabetes, they have to pretty much completely forget their life. ये खाना नहीं पड़ेगा, वो बंद करना पड़ेगा, इतना कौन करेगा यार? Somebody who's at the age of 70 might think, इस एज पे मैं खाना बंद करूंगा तो मैं जीऊंगा कैसे? छोड़ो, let's forget and eat the medications. So this, we have to change this. Who said that diabetes reversal means you have to give up on your lovely foods? Absolutely not. I will not let people give up on this. We have to see what is a way to navigate around. For some people, as per the books, diabetes reversal means when your HbA1c is below 5.7. But practically in everybody's life, reversal might mean some completely different. If somebody is on insulin for about 30 years of their life, maybe just getting off insulin is diabetes reversal for them. Maybe just feeling better without those pricks every single day is diabetes reversal for them? We have a different meaning to it. So it's not required for you to follow somebody else's footsteps or follow somebody else's goal. Please make your own goals, see what you want to achieve, how far you can go, what are the chances, what are the possibilities, and then make a plan which is sustainable for you for the rest of your life. It's not going in jail. It's not jail or diabetes. No, it's not. And I don't call my patients diabetic. I don't use this word. And again, I've learned this in my previous organization that you diabetic क्या होता है? You are somebody who has diabetes. It doesn't make you, it's not your identity that you are diabetic. We don't say that I am nails. We don't say that, right? I have nails. We are not known by nails. So how are we known by being a diabetic? No, you have diabetes, full stop. That can go. If in most cases, yeah. And of course, with people with type 1 diabetes who are insulin dependent for the rest of their lives, it doesn't mean that you can pump in X number of insulin in the entire day, or you can just behave the way you want. No, even you can achieve good health. Who said that having type 1 diabetes means you have to give up on your life completely? No, in fact, you can just take that and turn it around and make it your strength. Because I have seen so many type 1 diabetes patients actually having the best of their health, which is not even in people like you and me. Because they're so careful about their condition that they have completely turned their lives into a health freak, and which is excellent, I think. It's a blessing in disguise, rather.
True. And diabetes reversal also means for type 2 diabetes. For people who are having type 2 diabetes, it also means reversing all the complications which came with it, right? Like you said, you mentioned in that case that that person was able to go off the other medicines as well. That also means not suffering from cardiovascular complications and other so many complications which you might have if you have diabetes.
Maybe it might not 100% go away. Maybe it might not completely get better. Maybe heart will not go back to square one, but at least it will stop progressing. At least it will not get worse. It will be there where it is. So yeah, we have scope to work on every single thing. And I don't consider any person to be hopeless, or I don't give up on anybody. Even if that person wants to give up, I don't think that, even if that person is 99 years old, giving up is not an option. There's definitely that you can do something to help the person at least feel better, if nothing else.
That's so true. Anything you would like to add, Dr. Trishula, to this thing? Anything which you feel that the normal population doesn't know and they should know about this?
I think we pretty much covered every single thing.
Yeah.
So all I just want to say is diabetes is not the end of the world. For people who have been just diagnosed, or somebody who's been dealing with this for 30 years, no, it's not the end of the world. There are chances for you to feel better at every single moment of your life. All you need to do is take the right approach, see what works for you, see where you can fit yourself in the entire, you should do list. See what is something that you feel familiar with, intuitively what you feel is right, and just go ahead with it. Don't let anybody feel that diabetes or any other medical condition means you're done. Just somebody told me yesterday that willpower is very strong. So he went to the hospital at least twice, and we thought that he's not going to be coming back from the hospital, but he's back fit and fine. So yeah, the will to live, the will to get better does work. At the end, hum sabko jana hai. Like, nobody has a pill here ki we are going to live for eternity. No, we are not. We all have to leave, but why not make that life journey beautiful and at least pain-free as much as we can? And you and me, we are a part of this by choice or by profession, but we do see patients grow. We lose so many patients. We see this happening. We see the transition happening every single day in our lives, and that's what motivates us to get up every day and come to the clinic. So, despite me coming back from my holiday, I didn't even feel once ki, shit yaar, abhi Monday hai. No, I was looking forward to coming back to work because this is where I belong to. So no matter where I go in the world, switch off for a while, I know where I belong to. So find what works for you, what connects with you the most, and go for it. You will feel better. You have help everywhere. Universe guides you. Ask for guidance.
This was very motivational for all those people who are thinking of having their own setup and stuff as well.
Absolutely. I think, this all things that we connect to health somewhere connects to our personal journey as well. And I wasn't like this ever all the time. And, no, I was one of the most depressed girls anybody would know. And health issues, not giving up, like, I don't want to live. What is this? Cribbing and crying over every single thing in my life. And you change. When you find your life purpose, you change. I think I did. And that's what made me transform physically, mentally, emotionally, and been through a lot of ups and downs like everybody. And I think if I wouldn't have been through those ups and downs, I wouldn't have excelled. I wouldn't have been here where I am today. So I am so thankful for all the challenges life has given to me. I'm thankful for people who brought those challenges in my life. If it wasn't that, I wouldn't have been here. So a lot of gratitude to everything, and I accept, and I accept it very gracefully. I accept my failures also very gracefully. So yeah, it's all about getting up till the end of your life. Yeah. Otherwise, what's the point living this life?
That's what most of our patients also teach us.
They teach us, and that they are the only teachers that I have now. And trust me, what I've studied in my med school, I don't use it. And I have no, guts saying that even on a platform, that I don't use my medical knowledge. What I use is what my patients teach me. I didn't learn patience in the vet school. I didn't learn gratitude. I didn't learn hope. All I have learned through my practice. And that's what helps me go through the day. Hope, peace, gratitude. And I look forward to these things. I don't look forward to prescribing drugs. If somebody listens to my consultation, they might feel that this girl is mad. I talk 5 minutes of what they have to do, and whole 25 minutes is a discussion about how beautiful life is. Why not? Who said that the doctors have to be only about drugs and next patient? No. I think you can be in the moment, enjoy with them. You never even know what connected with them. They might come 5 years later and remember what you said, which you completely forgot. आपके लिए वो important भी नहीं होगा, but उनके साथ वो चीज रह जाएगी. So we all have to work in our consciousness, in our 100% surrender mode. It's not us. We have been sent on this planet to do the work. All we have to do is do the work, no ego, finish it. And once we're done, we'll be back to where we belong to.
This was so wonderful and so unfiltered. To be very honest, to all those who are listening, this was supposed to be a discussion on role of functional medicine in lifestyle disorder reversal, specifically diabetes. But it went to so much more, and I'm so happy that it did. This was an amazing conversation. I loved it. Thank you so much, Dr. Trishla. Anything else you'd like to add?
I think we're good. And we'll leave people with this beautiful discussion and keep it as raw and as unfiltered it is, because we are also human beings. And when we are talking about this, it's coming from our heart. We go through ups and downs too. We have bad days too. So it's good to have this discussion, Dr. Abhilasha, and let people connect with this raw and unfiltered version of us. They see too much of masking up any which ways on social media. So why not keep it real? Thank you. Thank you for having me.